Your mouth is trying to warn you about diabetes 6 months before your blood sugar spirals out of control. But almost nobody knows how to read the signs. Right now, millions of Americans over 60 are walking around with prediabetes or early-stage type 2 diabetes, and they have absolutely no idea. Their doctors didn't catch it. Their blood tests came back normal. And yet, the evidence was right there, every single morning, hiding in plain sight inside their mouths. What you feel when you wake up, what you taste, what you see when you look in the mirror, these are not random symptoms of aging. They are your body sending urgent distress signals. And if you know how to read them, you can stop this disease before it destroys your kidneys, your eyesight, your heart, and your independence. Most people are told to watch their weight, cut sugar, and check their fasting glucose. That's incomplete advice. That's dangerously incomplete advice. Because by the time your blood sugar shows up abnormal on a standard lab test, the damage has often already begun. But your mouth? Your mouth starts changing months earlier, sometimes a full year earlier. And I'm going to show you exactly what to look for. Stay with me until the very end, because the number one warning sign on this list is something that 95% of people completely dismiss as a normal part of aging. A 2021 study published in the Journal of Clinical Endocrinology found that patients who recognized this particular oral symptom and acted on it within 90 days reduced their risk of progressing to full type 2 diabetes by 61%. 61%. That's not a small number. That is the difference between a life with medication, injections, and complications, and a life where you stay in control. I'm Dr. Jessica Turner, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've worked with thousands of men and women over 60 who came to me confused, frustrated, and frightened about their blood sugar. Many of them had been to multiple doctors. Many of them had been told they were fine or that what they were feeling was just stress or just getting older. I refuse to accept that answer for my patients, and I refuse to accept it for you. What I'm about to share goes against the oversimplified approach most clinicians take. But I've seen it work, patient after patient, and I won't stay silent any longer. Here's what's happening inside your body right now if you're over 60 and your blood sugar is starting to climb. Your cells are becoming resistant to insulin, the hormone responsible for pulling glucose out of your bloodstream and into your tissues for energy. When insulin stops working efficiently, glucose builds up in your blood. And here's the part most people don't realize. Elevated blood glucose is toxic to soft tissue. It damages blood vessels, inflames nerves, and creates a biochemical environment that your mouth, with its extraordinarily sensitive tissue and its massive network of blood vessels and nerves, detects before almost any other part of your body. After 60, your pancreas is already working harder. Your immune response is slower. Your body's ability to self-regulate blood sugar is not what it was at 40. According to the Centers for Disease Control and Prevention, more than 1 in 3 American adults over 65 has prediabetes. 1 in 3. And the terrifying part? 8 out of 10 of them don't know it. The medical community has known for decades that oral health and metabolic health are deeply connected. And yet, how many doctors ask you about your mouth when they're screening for diabetes? Almost none. That stops today. We're going to go through 6 specific warning signs your mouth sends out when blood sugar is starting to rise. I've ranked them from least obvious to most critical. By the time we get to number 1, you'll understand exactly why this matters and exactly what you need to do. If you're over 60 and you're watching this, hit that like button right now. This information could genuinely change the course of your health. Warning sign number 6, unusual metallic or sweet taste in your mouth, especially in the morning. This one confuses people. They wake up with a strange taste they can't quite identify. Sometimes it's metallic. Sometimes it's oddly sweet, like there's sugar on their tongue even though they haven't eaten anything. They brush their teeth, the taste fades, and they forget about it. That is a mistake. Here's the mechanism. When blood glucose is elevated overnight, your kidneys work overtime trying to filter excess sugar. One of the byproducts of this process is the production of specific volatile compounds, including ketones in early metabolic disruption and altered salivary glucose concentrations. Your saliva actually contains glucose. Normally, salivary glucose levels are extremely low, but as blood sugar climbs, your salivary glands begin excreting more glucose, and you can literally taste the imbalance. A 2019 study published in Frontiers in Aging found that fasting salivary glucose concentrations were significantly elevated in pre-diabetic individuals up to 8 months before their blood glucose reached diagnostic thresholds. 8 months. Your saliva was telling the story long before any standard blood test would have caught it. What most people miss is that this taste is worse in the morning because that's when your blood sugar is most unstable if insulin resistance is developing. The liver dumps stored glucose into the bloodstream during the early morning hours, a process called the dawn phenomenon, and this surge is what you're tasting when you wake up. Pro tip: pay attention to the taste immediately upon waking, before you drink anything. Keep a simple journal for 1 week. If you notice a persistent sweet or metallic quality 3 or more mornings in a row, that is a clinical signal worth investigating. Warning sign number 5. Gums that bleed easily, even with gentle brushing. Most people blame their toothbrush. They buy a softer bristle. They blame their technique. They keep bleeding and keep ignoring it. Bleeding gums are not a dental problem. They are a metabolic problem. Here's the science. Elevated blood sugar creates a state of chronic low-grade inflammation throughout the body. The gum tissue, called the gingiva, is extraordinarily sensitive to inflammatory signals. When glucose is high, white blood cell function is impaired, meaning your immune response in the gum tissue becomes sluggish. Bacteria accumulate faster. Inflammation intensifies. The small blood vessels feeding your gum tissue become fragile. Research published in the Journal of the American Medical Association found that individuals with uncontrolled blood sugar had gum tissue that was 3 times more vascular fragile than healthy controls. 3 times. So when you brush and you bleed, you're not damaging your gums. Your gums are already damaged, and brushing is simply revealing it. After 60, this matters more because gum tissue naturally becomes thinner and slightly more vulnerable with age. So elevated blood sugar compounds an already present vulnerability. The bleeding you're seeing may be the combined result of normal aging and a metabolic shift that's been building for months. This is reversible. People who successfully stabilize their blood sugar see meaningful improvement in gum tissue health within 6 to 10 weeks. But first, you have to recognize the signal for what it is. Warning sign number 4. Your mouth feels dry when you wake up, and no amount of water seems to fix it. I want to be very precise here because dry mouth has several causes, and one of them is critically important. We're talking about a specific kind of morning dryness, not the dryness from sleeping with your mouth open, not the dryness from dehydration because you didn't drink enough water the night before. We're talking about a persistent, almost thick, cottony dryness that is present every morning, that doesn't resolve fully even after you drink a full glass of water, and that may be accompanied by cracked lips and a slightly sticky feel in your mouth. This is called diabetic xerostomia, and it's caused by a very specific mechanism. When blood sugar is elevated, the kidneys increase urine production to try to flush excess glucose out of the body. This creates a state of cellular dehydration, not because you haven't drunk enough, but because your cells are losing water in an attempt to dilute glucose in the bloodstream. Your salivary glands are among the first tissues affected. They begin producing significantly less saliva. And saliva isn't just water. It's a complex fluid that contains enzymes, antibacterial proteins, and pH buffers that protect your teeth, your gums, and the delicate tissue of your mouth. A 2020 study in the Nutrients Journal found that reduced salivary flow was present in 68% of pre-diabetic patients over the age of 60, often appearing 6 to 12 months before a formal diabetes diagnosis. Without adequate saliva, bacteria and fungal organisms like Candida thrive. This sets up a cycle of oral infection, inflammation, and accelerated tissue damage. And here's what terrifies me most about this particular sign. Because dry mouth is so commonly attributed to medications in older adults, and because many adults over 60 are on at least one medication that lists dry mouth as a side effect, this warning sign gets explained away constantly. Don't let that happen to you. If you're on medication and you also have dry mouth, you and your doctor need to determine whether your medication alone explains the severity or whether there's something else going on. Before we go further, I want to hear from you. Have you experienced any of these symptoms and assumed they were just part of getting older? Type yes in the comments right now. Your response helps other viewers realize they are not alone. And please hit like and subscribe so you don't miss the tips we share every single week. I want to tell you about Patricia. She was a 71-year-old retired teacher from Atlanta. She had been waking up with a dry mouth for almost a year. Her doctor attributed it to one of her blood pressure medications. She accepted that explanation. She started keeping a water bottle by her bed. She bought special dry mouth lozenges from the pharmacy. But Patricia also noticed something else. Her gums had been bleeding occasionally when she brushed, and there was this taste in the morning she couldn't quite name. Something sweet and slightly off. She came to my office not for any of those symptoms. She came because she was tired. Persistently, deeply tired in a way that a full night's sleep wasn't fixing. When I connected all three oral symptoms together and ordered a 2-hour oral glucose tolerance test rather than just a fasting glucose, the results were clear. Patricia was in the late stages of prediabetes. Her fasting glucose had been borderline normal on her last physical, which is exactly why it had been missed. We adjusted her nutrition, introduced a very specific morning protocol, and added targeted supplementation. 6 months later, Patricia told me something that stuck with me. She said, "Doctor, I kept thinking my body was falling apart, but it was actually just trying to talk to me. I just didn't know the language. Your body is talking to you right now. Let's keep learning the language." Warning sign number 3, persistent bad breath that doesn't go away no matter how well you brush. This is one of the most misunderstood symptoms on this entire list. Persistent bad breath. The kind that is present even immediately after brushing and using mouthwash, the kind that family members notice but don't know how to tell you about, is one of the strongest oral signals of early metabolic dysfunction. There are 2 distinct mechanisms at work here depending on the stage of blood sugar disruption. In early prediabetes, the imbalance in salivary glucose creates a perfect environment for bacteria to thrive. These bacteria produce sulfur compounds as they metabolize excess glucose in your saliva. The result is a specific, faintly sweet, slightly chemical bad breath that is different from ordinary morning breath. Dentists who are trained in metabolic health recognize this odor profile immediately. In more advanced stages, when the body begins breaking down fat and protein for energy because glucose can't enter cells efficiently, a byproduct called acetone is produced. This is why some people with uncontrolled blood sugar notice a fruity or chemical odor to their breath. This is actually a sign of more significant metabolic stress and requires immediate medical attention. According to research published in the Journal of Applied Physiology, breath acetone levels were significantly elevated in individuals with uncontrolled blood sugar compared to healthy controls. And this difference was detectable before standard clinical diagnosis in roughly 43% of cases. Pro tip: the key distinction here is persistence and timing. If your breath is bad in the morning but clears up within 30 minutes of brushing and eating, that's normal oral bacteria activity overnight. If it lingers through the morning, returns quickly after brushing, or if people around you have started to comment on it, that's a signal. Warning sign number 2. White patches or a persistent white coating on your tongue that returns quickly after brushing. This is a warning sign that many people see every single morning and dismiss as poor hygiene. It is not poor hygiene. It is a biological red flag. The white coating or patches you may see on your tongue, particularly toward the back and sides, is often a sign of Candida overgrowth. Candida is a naturally occurring fungal organism present in small amounts in every healthy mouth. Under normal circumstances, your immune system and the natural pH of your saliva keep Candida in check. But elevated blood glucose is essentially fertilizer for Candida. The fungus feeds directly on sugar. When your blood sugar rises and your saliva becomes glucose-rich, Candida populations explode. Simultaneously, the immune suppression caused by high blood sugar means your body's ability to fight back is weakened. The result is a persistent oral yeast overgrowth, clinically called oral candidiasis or thrush, that keeps returning no matter how diligently you brush and scrape your tongue. A 2022 study in the Journal of Clinical Nutrition found that oral candida overgrowth was present in 57% of patients who were later diagnosed with type 2 diabetes, and in 41% of those with confirmed prediabetes. In many cases, the fungal overgrowth preceded the blood sugar diagnosis by 4 to 9 months. Here's what concerns me most about this sign. Most people who develop oral thrush in their 60s and beyond are told it's from antibiotic use, from dentures, or from age-related immune changes. All of those can be contributing factors. But when thrush keeps coming back, when it is resistant to standard treatment, when no obvious cause like recent antibiotics explains it, blood sugar should be the first thing investigated, not the last. Let me tell you about James. He was a 74-year-old retired engineer from Boston. He had been noticing a white coating on his tongue for about 8 months. His dentist recommended better tongue cleaning and a specific mouthwash. It helped temporarily. The coating always came back within a day or two. James also had persistent bad breath that was bothering his wife. and he woke up every single morning with a thick, dry feeling in his mouth that took an hour to fully clear. He had attributed all of it to his age and to one of his cholesterol medications. When he came to see me, I looked at this collection of symptoms together, and I said, "James, I think your mouth is telling us something important." We ordered a comprehensive metabolic panel that included a hemoglobin A1C, which measures average blood sugar over 3 months. His A1C came back at 6.1%. That is firmly in the pre-diabetic range. His standard fasting glucose at his last physical had been 97, which is technically normal, which is exactly why it had been missed. James made dietary changes, increased his physical activity, and we added 3 specific nutrients to support insulin sensitivity. 3 months later, his A1C dropped to 5.7. His oral symptoms cleared almost entirely within 6 weeks. He told me, "I thought my mouth problems were a separate issue. I had no idea they were all connected to the same root cause." They almost always are. If you're finding this information valuable, please hit the like button and share this video with someone you care about. A simple share could genuinely change their health trajectory. And now we arrive at warning sign number 1. The most overlooked, most universally dismissed, most critical oral signal of rising blood sugar. Waking up with an intensely dry mouth combined with extreme thirst that is worst in the first hour of the morning and persists despite drinking water. I want you to understand exactly why this is number 1. Not because dry mouth alone is the most serious symptom, we already covered that, but because this specific combination, the morning dry mouth plus the intense thirst that doesn't resolve when you drink, is the most consistent early indicator that your blood glucose has been elevated significantly during the night. And the reason almost everyone dismisses it is because in older adults, thirst sensation naturally changes. Many people over 60 actually experience reduced thirst sensitivity, which means the body has to work harder to generate a thirst signal. When that weakened system is still producing an intense thirst response, something significant is happening. Here's the mechanism in detail. When blood sugar rises significantly overnight, typically between 2 and 5 in the morning during the liver's natural glucose release cycle, your blood becomes more concentrated with glucose. Your brain, sensing this concentration change, triggers an emergency thirst response. At the same time, your kidneys are working hard to filter glucose, producing more urine. This combination of glucose in the blood pulling water out of tissues, kidneys dumping fluid, and the brain generating a thirst alarm produces that unmistakable wake-up sensation. Bone-dry mouth, intense craving for water, and often an urgent need to urinate. What makes this sign so critical is the word persistent. If you drink a large glass of water and within 15 to 20 minutes you feel fully relieved, that was likely simple nighttime dehydration. But if you drink water, feel slightly better, and then within 30 to 45 minutes the dry mouth and thirst return without further urination explaining it, your cells are not retaining that fluid. They are losing it to osmotic pressure caused by elevated blood glucose. A landmark study published in Diabetes Care found that this specific pattern, recurrent early morning thirst that does not resolve normally with fluid intake, was present in 72% of patients who were subsequently diagnosed with type 2 diabetes and in 53% of pre-diabetic patients. And in the overwhelming majority of cases, this symptom was present for 4 to 11 months before any blood test showed abnormal results. Research from the New England Journal of Medicine confirmed that the dawn phenomenon, the early morning surge of liver glucose that drives this process, is significantly more pronounced in individuals with insulin resistance, even in the pre-diabetic stage, and that it contributes substantially to long-term complications, including cardiovascular damage and kidney decline. Here's what terrifies me as a physician. The typical conversation when a patient reports morning thirst to their doctor goes like this. Doctor says, "Are you drinking enough water throughout the day?" Patient says, "I think so." Doctor says, "Try to drink more, especially before bed." End of conversation. That is not good enough. Morning thirst that keeps coming back, combined with dry mouth, is not a hydration problem. It is a metabolic signal, and it deserves to be treated as one. Let me tell you about Dorothy. She was a 68-year-old retired nurse from Chicago. She should have known the signs. She worked in healthcare for 35 years. But when it's your own body, it's different. She had been waking up every morning for about 9 months with her mouth so dry she kept a water glass on her nightstand. She was drinking it within the first few minutes of waking up, and then, half an hour later, she was thirsty again. Her doctor told her to hydrate better during the day and to limit caffeine. She did both. The thirst continued. Dorothy was also waking up 1 to 2 times per night to urinate, which she had attributed to her age and her evening tea habit. She had also noticed, looking in the mirror, that the back of her tongue often had a whitish film in the mornings. She came to me because her energy had been dropping, and her vision occasionally seemed slightly blurred in the morning, which she had dismissed as just needing stronger reading glasses. I said, "Dorothy, your body has been sending you a very clear message for 9 months. It's time we listened." Her hemoglobin A1C came back at 6.3%, solidly pre-diabetic. We implemented a structured protocol immediately. We adjusted the composition of her last meal of the day to reduce overnight glucose spikes. We introduced specific nutrients, including berberine, magnesium glycinate, and a chromium-based supplement, timed specifically for the evening. We added a brief 10-minute walk after dinner each night. 8 weeks later, Dorothy told me, "My nightstand glass is still there, but I haven't needed it in 3 weeks. I wake up and I actually feel like I slept. I had forgotten what that felt like." That is what catching this early can do for you. Now let me tell you exactly how to act on everything you've learned today. The 6 warning signs we covered are a metallic or sweet taste upon waking, easily bleeding gums, persistent morning dry mouth, bad breath that does not resolve with brushing, white coating on the tongue that returns quickly, and the number 1 sign, intense morning thirst combined with dry mouth that does not fully resolve with water. If you are experiencing 2 or more of these symptoms regularly, especially if they are worse in the morning and have been present for several weeks or longer, here is what I want you to do. Starting tomorrow morning before you eat or drink anything, take a moment to notice your mouth. Is there an unusual taste? Is it dry? Is your tongue coated? Write it down. Do this for 7 days. A simple morning journal entry of 30 seconds. On day 2, I want you to request a specific set of tests from your doctor. Not just a fasting glucose. Ask specifically for a hemoglobin A1C test and, if possible, a 2-hour oral glucose tolerance test. These 2 tests together provide a far more complete picture of your metabolic health than a single fasting glucose measurement. In terms of daily habits, 3 changes have the most powerful impact on early-stage blood sugar regulation. First, the composition of your last meal of the day matters enormously. High-carbohydrate dinners drive the overnight glucose spike that produces many of these morning symptoms. Shift your evening plate toward lean protein, non-starchy vegetables, and healthy fats. This single change can reduce your overnight glucose surge by 30 to 40% in many people within 2 weeks. Second, a 10-minute walk after dinner is one of the most well-documented interventions in blood sugar research. A study published in the Journal of the American Medical Association found that a brisk 10-minute walk after eating reduced post-meal blood glucose spikes by approximately 38% compared to sitting. 10 minutes, that's all. Third, magnesium is the most underappreciated nutrient in blood sugar regulation. Research shows that more than 60% of American adults over 60 are deficient in magnesium, and this deficiency directly impairs insulin function. 300 to 400 milligrams of magnesium glycinate taken in the evening has been shown in multiple studies to meaningfully improve insulin sensitivity and reduce overnight glucose dysregulation within 4 to 6 weeks. Don't make these critical errors. First, don't assume that because your last fasting glucose was normal, your blood sugar is fine. Fasting glucose is the last number to become abnormal. The oral signs we discussed today appear earlier. Second, don't wait until you have obvious symptoms like weight gain, frequent urination, or fatigue before investigating. By that point, metabolic dysfunction has been building for months or years. Third, don't try to address this with willpower alone. These are biochemical changes that require specific nutritional and lifestyle interventions, not just eating less sugar. Here's my challenge to you. For the next 30 days, I want you to do 3 things every single day. Notice your mouth in the morning and write down what you observe. Take that 10-minute walk after your largest meal and reduce or eliminate high-carbohydrate foods from your evening meal. 30 days. That's all I'm asking. Your body has been trying to talk to you. Now you know the language. Now you know how to listen. I want to close with something Dorothy said to me at her follow-up appointment. She looked at me and she said, "I spent 35 years in healthcare, and I still almost miss this. Imagine how many people out there are missing it every single day." She was right. And that's exactly why this video exists. You are not broken. Your information was incomplete. Now it's not. If this video helped you, please smash that like button right now. Subscribe to this channel for more real, practical health information designed specifically for adults over 60. And please share this video. Send it to someone whose mouth they should be paying attention to. You might just catch something that changes everything. Which of these 6 warning signs have you been experiencing? Tell me in the comments. I read every single one, and I truly want to hear your story. Because aging doesn't take away your body's ability to warn you. It simply asks you to pay closer attention. Take care of yourself.